Howdy, y'all. Welcome to the Quad Life. Well, we are continuing with our September series on spinal cord injury awareness. And today I'm going to talk about something that is unique for those of us with higher injury levels, but it is something that needs to be very well known. And that is something called autonomic dysreflexia, or AD for short. So the Cleveland Clinic here, they have a good description of it and what the basic symptoms are. So AD is a dangerous syndrome involving an overaction of your autonomic nervous system to cause a sudden and severe rise in blood pressure in addition to other symptoms. People who've had a spinal cord injury are most at risk. AD requires immediate treatment. Now, AD is something that I think has become more known in the past few decades. I know that when I was originally injured, that it wasn't something that we really knew about or talked about, or at least at my age, I didn't understand. Mm, We knew that I would have some problems though if we let certain things go too long or that kind of thing. But just one of those things that over the years I learned that it actually had a name. So, kind of what happens and what do we look at? Symptoms of AD can vary. So, it can be, as the list says here, excessive sweating, slow heart rate, skin flushing, goosebumps, cold skin, and more. So, when I start the AD, I can feel my blood pressure go up and I get really warm. Also, my face will turn red and my eyes will be white. So, as I've heard, I look like a backwards raccoon. But for me, it's something I'm familiar with, so I know when it's getting bad or when it's just something that's going to pass quickly. So, what triggers AD? And this gives three reasons: bladder, bowel, and skin. And these are by far the most common causes of it. Needing to use the bathroom for either reason, and skin problems. So for me, I often get AD if, I need to use the restroom or I've had too much to drink of water or anything else. I have not experienced it with skin problems very much. I know some people can have trouble if they've had, say, a wrinkle in their shorts or something of that sort. For me, if I have that kind of thing going on, then I tend to have more muscle spasms and that kind of thing. But I also get AD if I get overheated and my body is not sure how to cool off, and that's the big one for me, especially during the summer. So the thing with AD though is to make sure that you get rid of whatever is going on. So obviously for the first two causes there, do whatever routine you need for bathroom needs. When you're out and about, it isn't as easy as especially in my case, having a female caregiver with me, it's difficult to find a restroom that we can use. There are a few areas, like at large Walmarts or Targets, they may have a family restroom that both of us can use, but it can get to be a real problem at times. But for skin trouble, definitely be aware of what you're wearing. And if you're doing something, say like exercises or that kind of thing, that's when clothes can get tight or wrinkled and to cause more problems. But as long as you're aware of it and know what it is, then most cases can be treated pretty easily. Unfortunately, it's not always the case that people know what AD is. And you really have to explain what's going on. And as I'm speaking about AD here, I feel a slight amount of it going on, which my body does. Anyway, this is an item I talk about frequently when I talk at colleges because, again, very few ever do. I recently found out that a friend of mine is attending a school in northwest Iowa and working on her nursing degree, and they actually do cover this. So that made me happy, and to know that at least someone talks about it. But management and treatment, just be very careful with it and make sure that the people you're working with know about it, because even at hospitals, they don't know what things exist and they just may disregard it, which can lead to deadly consequences such as strokes or heart attack or anything of the sort. But talk about that more in another video coming up. So, thank you for watching, and bye for now.